Medicare Prescription Part D Drug Plans. Hello, I'm Kevin Knaus with InsureMeKevin.com, and today I'm going to be going over the Medicare Prescription Part D Drug Plans. Now, original Medicare does not cover prescription medications. The Part D plan was introduced 2006 and has gone through many different revisions, but it is one of the most complicated insurance products I've ever seen. And I think it was written by the insurance companies for the insurance companies, but there are some really great benefits for the beneficiaries of these Part D plans, but they can be confusing when you're trying to compare them. So I'm going to try and go over a high-level overview of some of the different parts of the standard Medicare plan. Now, all of the plans out there may look exactly like the standard Medicare plan, but many of them are different because Medicare allows them to have different plan structures and benefits. And I'm not going to be getting into any of the specific benefits of any particular plan, but just to kind of give you an overview of how they go about tabulating and accumulating the costs for some of these. And I'm going to spend a little bit of time on the coverage gap because that's an area that is most confusing when people move into that coverage gap, which used to be known as the donut hole. So, our Part D plans have four coverage phases. There's a deductible, an initial coverage phase, a coverage gap, and then catastrophic. And all of these are based on a dollar amount that either the beneficiary spends or a combination of the beneficiary and some of the drug manufacturer discounts. In the deductible phase, you pay the full retail price for the drug at your pharmacy. Some plans do not have a drug deductible. Some plans may have a deductible that only applies to certain drug tiers. But you have to move through that deductible phase before you get into the initial coverage phase where the prices drop. Now let's look at this hypothetical situation where a member has a prescription for hydroxyquinone. Now that's a made-up drug. In Latin it means horse pill. But hydroxyquinone, the list price, the retail price, is $100 at the pharmacy. So if they have a standard Medicare Part D plan with that deductible, and the deductible is $400, then if that's the only drug they take, for 4 months, they will have to pay that full $100 retail price until they meet the deductible, and then they go into a co-insurance or co-pay situation. And that is the initial coverage phase, once you've moved through the deductible. Again, not all plans have a drug deductible. And all the drugs on the list of this thing called a formulary are broken up into tiers. At a minimum, there's going to be 4 tiers. Some drug plans may have 6 tiers. Your first tier is usually generic, and then there are preferred brand, non-preferred, specialty drugs, and specialty drugs are injectables or high-cost brand name drugs. And as the tiers go up, generally the price, the co-payment that you pay also goes up. Some drug plans may have a drug tier where there is zero cost share for maintenance drugs like high blood pressure. So let's say you are taking hydroxyquinone, you've gone through your deductible phase, now you're into your initial coverage phase, and hydroxyquinone is a tier 2 drug on your drug plan, and the copay is $15 a month. So your drug costs drop from $100 a month down to $15. So you're going through the initial coverage phase, and all of these costs are adding up. And when all of your costs add up to, it's going to be about $4,100, then you hit this coverage gap. Now, in the initial coverage phase, you're supposed to be paying 25% of the retail price, but some of these, $15 obviously is not 25% of $100 list price. But again, we have to remember that these plans are actuarially equivalent. So Some drugs may be lower, some may be higher, and it'll depend on the plan. On average, the average consumer will be paying about 25% for the drugs in the initial coverage phase. So now we go into the coverage gap. And some people will say, well, that's 25%. How is that any different? Well, now you do pay that full 25% for hydroxyquinone. It's no longer $15. It is now $25 per month. And this is where some of the math gets kind of tricky and complicated. There's this one particular part of the Part D plans called true out-of-pocket, TROOP. And the TROOP is, part of that is what you are paying for your drugs out of pocket. And then when you're in the coverage gap, they credit you 70% discount from the manufacturer's price. So I guess this is all negotiated behind the scene. The plan pays 5% for the drug in the coverage gap. So in this particular case with hydroxyquinone, you are paying 25%. There is a 70% drug discount that is credited to your account, and then the plan pays 5%. So you get credited for 1 month $95 or true out of pocket towards meeting the catastrophic phase. And the catastrophic phase, this is where the drug prices really drop substantially. There are 2 different levels. There's generic and brand name. So there's going to be a specific price for generic drugs that is quite low, and then a little bit higher for a brand name drug, and or 5%, whichever is more expensive. So if the brand name copay in the catastrophic phase is $10 and our hydroxyquinone is $100, that's 5%, that would be $5. You'd be paying the $10 price, not the $5 price. And then that goes through the remainder of the year when you're in the catastrophic phase. And hopefully you don't have to. Now, some people will meet that catastrophic phase sooner because most people are not just taking hydroxyquinone, they're taking other drugs as well. And that's where it gets kind of odd, because the 70% drug discount for one drug may be much higher than for another drug, your neighbor, and you may reach the catastrophic level much sooner than your neighbor does, even though you have kind of essentially the same costs every month in that coverage gap. But it's all very complicated. Medicare.gov does a great job on their website of helping you search through all of the different drugs and the drug costs. I highly recommend you going to Medicare.gov and the Drug Finder program to put in the drugs for that and see, and then look at all the different plan. And they are complicated, and it does take time. And if you don't have time, find yourself a good agent or a family member to help you kind of look at all these so you can get the greatest benefit from these Part D plans. There is also a low-income subsidy from Social Security. You might be eligible for that. You need to apply for Social Security to see if you can get some extra help paying either the co-pays or the drug plan premiums. And of course, if you're in your state Medicaid program, you will probably also qualify for that low-income subsidy to help with the drug costs. So hopefully that kind of helps out. If you have any questions, give me a call. I will certainly try and help you, or you can leave comments down below and we'll answer those as best we can. Again, I'm Kevin Knaus for InsureMeKevin.com. Take care.